My name is Shanika Baylor, and I will be presenting on complementary and alternative treatments for hypertension. The National Heart, Lung, and Blood Institute, or NHLBI, functions to promote the prevention and treatment of heart, lung, and blood disorders. NHLBI has several different divisions and centers, 3 of which specifically focus on heart, lung, and blood disorders. The Division of Blood Diseases and Resources focuses on blood diseases and disorders that are not related to tumor growth, including anemias, venous thromboembolisms, which include blood clots in the veins and lungs, hemophilia, and sickle cell disease. It is estimated that approximately 1.2 million Americans develop blood clots annually. The Division of Lung Diseases oversees a wide variety of diseases including asthma, COPD, cystic fibrosis, tuberculosis, and sleep disorders. It is estimated that 25 million Americans and 15 million American adults have asthma and COPD respectively, with annual healthcare costs reaching $20 billion. Approximately 50 to 70 million Americans are believed to have some type of sleep disorder, and annual costs are $150 billion, with approximately 87 billion lost in productivity, 27 billion lost in motor vehicle accidents, and 6.5 billion lost in workplace accidents. The Division of Cardiovascular Sciences focuses on heart and vascular health across a person's lifespan. Some of these heart issues include heart attacks, heart failure, strokes, and congenital heart diseases. Major determinants of heart disease include obesity, physical inactivity, poor diet, diabetes, use of tobacco products, and hypertension. Heart disease is the leading cause of death for both men and women in the United States. Approximately 840,000 people died from heart disease in 2016, and it is estimated that $351 billion were spent in total healthcare costs due to cardiovascular disease between 2014 and 2015. 1 million people are expected to experience some type of coronary event in 2019. Hypertension, or high blood pressure, occurs when the force of your blood pressure pushing against the walls of your blood vessels is higher than it should be. It is known as the silent killer because it often has no signs or symptoms. For most people, it is diagnosed when they visit their doctor. Hypertension can be classified as either primary or secondary and is diagnosed based upon the systolic and diastolic numbers. The systolic blood pressure or top number tells how hard arteries have to push blood through when the heart contracts, and the diastolic blood pressure or bottom number tells the pressure in the arteries between beats. Blood pressure is considered to be elevated when systolic blood pressure is between 120 and 129 millimeters of mercury. A person is diagnosed with stage 1 hypertension if their systolic blood pressure is between 130 and 139, or their diastolic blood pressure is between 80 and 89 millimeters of mercury. A person is diagnosed with stage 2 hypertension when their systolic blood pressure is greater than 140, or their diastolic blood pressure is greater than 90 millimeters of mercury. When being treated with medications, blood pressure is considered controlled when SBP is less than 130 and or diastolic blood pressure is less than 80. Current treatment for hypertension includes lifestyle modifications and medications. Lifestyle modifications include using the DASH or Mediterranean diet to decrease sodium consumption, tobacco cessation, weight loss, and increases in physical activity. Pharmacologic treatment includes medications from 9 different classes of medications that may be taken alone or in combination to help decrease blood pressure. 1 in 3, or 75 million Americans, have hypertension, but many of them go undiagnosed. Amongst those affected, 40.3% are Black. Only about half of those diagnosed with hypertension are being treated, and of those being treated for hypertension, only 50% have it controlled. It is estimated that suboptimal blood pressure control accounts for 7.6 million premature deaths annually. Annual costs are estimated to be $51.2 billion per year, with the anti-hypertensive population spending about $131 billion per year more in healthcare expenses when compared to those who do not have hypertension. Modifiable factors for hypertension include poor diet, physical inactivity, tobacco use, diabetes diagnosis, obesity, and excessive alcohol consumption. Long-term uncontrolled hypertension can lead to kidney damage, cardiovascular damage, and blindness. Some social determinants of hypertension include food insecurity, economic instability, and lack of education. The pathophysiology of hypertension is one that is complex and involves several different mechanisms. Too much sodium and a lack of potassium can lead to an increase in blood pressure. This can come from an increase in dietary sodium and lack of dietary potassium that comes from fruits and vegetables, or it can come from a defective sodium-potassium pump that can lead to an increase in sodium in the body. Cardiac output is the amount of blood the heart pumps through the system in 1 minute, and total peripheral resistance is how much the arteries constrict when blood enters into them. In hypertension, cardiac output is normal and total peripheral resistance is elevated, which leads to a thickening or narrowing of the arteries, which increases blood pressure. When the renin-angiotensin-aldosterone system, or RAS, is not functioning properly, it can lead to increased vasoconstriction due to increases in angiotensin II, as well as retention of sodium in water, which can lead to hypertension. The autonomic nervous system deals with the central blood pressure as well as fight and flight responses. When it is overactive due to stress or other factors, it can lead to increased blood pressure. Certain genetic factors and genetic mutations can lead to the development of essential hypertension. Finally, endothelial dysfunction occurs when there is a decrease in bradykinin or nitric oxide, which are potent vasodilators, and this leads to higher blood pressure. Beetroot juice, whose scientific name is Beta vulgaris, is one alternative treatment that has been utilized not only for blood pressure control, but also for increased energy and increased blood flow. Beetroot juice is believed to work by improving the nitrite-nitric oxide pathway. Beetroot juice contains approximately 25% of inorganic nitrate, and when it is consumed, nitrate comes in contact with bacteria in the saliva that reduce nitrate to nitrite. In the stomach, nitrite is reduced to nitric oxide, whereby some enters the bloodstream, leading to vasodilation and decreased blood pressure. Study number 1 was a 28-day, 2-arm, parallel, randomized control trial. 24 participants with a BMI between 25 and 40 and age 55 to 70 were randomized to either drinking 70 milliliters of concentrated beetroot juice with a labeled concentration of 300 to 400 milligrams of inorganic nitrate per bottle, or 200 milliliters of black currant juice daily for 21 days, followed by a 7-day washout period. Both groups were to eat a low nitrate diet during the trial. Changes in systolic and diastolic blood pressure were assessed in 3 different phases: clinic blood pressure, 24-hour ambulatory blood pressure, and daily home blood pressures. Resting clinic and 24-hour ambulatory blood pressures were assessed at baseline and at the end of weeks 3 and 4. Home blood pressure were monitored for the full 28 days of the trial. After 3 weeks of supplementation, the daily home systolic blood pressure in the beetroot juice group was found to be significantly lower when compared to the placebo group. There were no changes found in the clinic or 24-hour ambulatory blood pressures. 1 week post-supplementation, the beetroot juice group's blood pressures had returned to baseline. The only adverse event reported was beeturia. Limitations of this study were that post-trial analysis of the beetroot juice supplement was found to have a significantly lower amount of nitrate per serving at 165 milligrams per bottle as opposed to the 300 to 400 milligrams that was reported on the label. The sample size was small, the duration of the trial was short, and neither the participants nor researchers were blinded. Overall, beetroot juice supplementation was shown to have a significant decrease in systolic blood pressure at home after 3 weeks in older, overweight individuals. Study number 2 was a 5-week randomized placebo-controlled double-blind crossover study that assessed daily home blood pressure and 24-hour ambulatory blood pressures on day 7 of each intervention. 27 participants taking 1 to 3 medications for high blood pressure had a 1-week lead-in period followed by 2 1-week intervention periods consuming either 70 milliliters of nitrate-rich or 70 milliliters of nitrate-depleted beetroot juice twice daily for 7 days with a 2-week washout period between the interventions. They were asked to consume a low nitrate diet throughout the entire 5 weeks of the study. 8 participants were taking 1 blood pressure medication, 14 participants were taking 2 blood pressure medications, and 5 participants were taking 3 blood pressure medications. The combinations in which they were taking these medications were not listed. After 1 week of supplementation with nitrate-rich beetroot juice, there was no change in blood pressure in people on antihypertensive treatment. Limitations to this study were it was of short duration and there was a small sample size. No adverse events were reported. Study number 3 was a randomized phase 2 double-blind placebo-controlled trial that assessed the change in clinic, ambulatory, and home blood pressures in a total of 68 participants. Secondary measures assessed were endothelial function and arterial stiffness. 34 treatment-naive and 34 treated hypertensive participants had a 2-week run-in period followed by 4 weeks of receiving the intervention of 250 milliliters daily of nitrate-rich beetroot juice or the control of 250 milliliters of nitrate-depleted beetroot juice. Participants were asked to not alter their diet or change their antihypertensive medications during the study. After 4 weeks of supplementation, clinic systolic and diastolic blood pressures were decreased by 7.7 and 2.4 millimeters of mercury respectively when compared to baseline. 24-hour systolic and diastolic ambulatory blood pressures were also found to decrease by 7.7 and 5.2 millimeters of mercury respectively when compared to baseline. Neither of these changes were seen in the placebo group. Home blood pressures were seen to decrease after 1 week of beetroot juice supplementation, but did not reach a level of significance until the 3rd week of supplementation. Systolic and diastolic blood pressures decreased by 8.1 and 3.8 millimeters of mercury respectively, with a progressive return to baseline after 2 weeks of stopping the beetroot juice. Endothelial function improved by about 20%, and the arterial stiffness was also found to be reduced at the end of the study. Reported adverse events were beta-urea and fecal discoloration. Limitations to this study were its small sample size and short duration. Also, classes of antihypertensives that the treatment group were on were not listed. This study showed a significant improvement in all 3 blood pressure measurements over 4 weeks in both treatment-naive and treated participants who had uncontrolled hypertension. These changes in blood pressure were comparable to blood pressure reduction achieved with 1 prescribed antihypertensive medication, which has been shown to be approximately 9.1 over 5.5 millimeters of mercury decrease on average. The data concerning beetroot juice is inconsistent. Trials 1 and 3 showed significant improvement in blood pressure after 3 weeks of supplementation with beetroot juice, while trial 2 showed no change in blood pressure after 1 week of supplementation. There was not a consistent dose of beetroot juice, and trial 1 showed that there can be variations in the content of nitrate in beetroot juice despite what the label reports. Also, length of treatment needs to be established as it appears there is a cumulative effect with beetroot juice. While beetroot juice appears safe and there were no drug interactions with antihypertensive medications reported, beetroot juice has a high oxalate content and may need to be avoided in those who are predisposed to oxalate renal stones. Aged garlic extract is one of the many different types of garlic supplements that are available on the market. Garlic, scientific name Allium sativum, has documented uses since ancient times. Ancient Egyptians and sacred Indian texts recommended using garlic for circulatory disorders. Ancient Greeks used garlic as a diuretic, and it has also documented uses to strengthen the immune system and for GI health. Raw garlic and garlic powder are composed of allicin and allicin, respectively. Both of these have unstable sulfur components, and allicin is destroyed when cooked. Sulfur is believed to work to improve blood pressure in garlic. GI intolerances have been shown, and they can lead to a reduction in red blood cells. Garlic essential oil cannot be standardized, and usually only a small amount is available in large oil vehicles. Aged garlic extract contains S-allocystine, or SAC, which can be standardized and is stable and tolerable. Aged garlic extract is believed to work by stimulating nitric oxide and hydrogen sulfide production, blockage of angiotensin II production via ACE, and decreasing oxidative stress by trapping reactive oxygen species. All of these lead to vasodilation, smooth muscle relaxation, and a decrease in blood pressure. Study number 1 was a double-blind, parallel, placebo-controlled, randomized trial whose purpose was to determine aged garlic extract's effectiveness as an adjunct treatment to antihypertensive medications in patients with treated but uncontrolled hypertension. 50 patients on various antihypertensive medications were randomized to either 4 capsules of aged garlic extract branded as Kyolic, totaling 960 milligrams of aged garlic extract and 2.4 milligrams of SAC, or 4 placebo capsules daily for 12 weeks. Placebo capsules were matched to size, odor, and color of intervention capsules. The primary outcome was change in systolic and diastolic blood pressure measurements at baseline, 4, 8, and 12 weeks in a clinic setting. 40% of participants were taking 1 blood pressure medication, 26% were taking 2 blood pressure medications, and 30% were taking 3 or more antihypertensive medications. There was a 10.2 millimeter of mercury decrease in systolic blood pressure in the treatment group, which was significant. Reported adverse events included belching, acid reflux, and altered taste. Limitations to the study included the option to take capsules, either 2 capsules twice daily or all 4 at the same time once daily, small sample size, low number of trial participants that had uncontrolled blood pressure under trial conditions, and no subgroup analysis of treatment effects of aged garlic extract based upon which antihypertensive medications participants were taking due to small sample size. And those who had uncontrolled systolic blood pressure of greater than or equal to 140 millimeters of mercury under trial conditions, aged garlic extract was found to be an effective adjunct therapy to patients on antihypertensive. This was a double-blind, randomized, placebo-controlled dose-response trial that aimed to assess the effectiveness of different doses of aged garlic extract in those who had uncontrolled hypertension while receiving traditional hypertensive therapy. 79 participants with a systolic blood pressure greater than 135 millimeters of mercury were allocated to either receiving 1, 2, or 4 Kyolic capsules that contained 240, 480, or 960 milligrams of aged garlic extract, and 0.6, 1.2, or 2.4 milligrams of SAC, or placebo capsules that were matched to treatment capsules in number, shape, size, color, and odor. Treatment and placebo were given daily for 12 weeks, and clinic blood pressure was assessed at baseline, 4, 8, and 12 weeks and were compared. Participants took an average of 2 blood pressure medications. Mean systolic blood pressure was significantly reduced by 11.8 millimeters of mercury in the garlic 2-capsule group over 12 weeks when compared to placebo, while the 4-capsule group reached borderline significant reduction in systolic blood pressure at 8 weeks. Change in systolic blood pressure ranged from a decrease of 40 millimeters of mercury to an increase of 5 millimeters of mercury, and 1/3 of participants had only a 5 millimeter of mercury change in systolic blood pressure. GI side effects included constipation, bloating, flatulence, reflux, and garlic taste. Other reported side effects were difficulty swallowing capsules, dry mouth, and cough. Most of the GI side effects resolved after the first week of the trial. Limitations included a small sample size, short duration, and a variety of antihypertensive treatment combinations with no subgroup analysis on the effects of aged garlic extract due to small sample size. A dosage of 2 capsules totaling 480 milligrams of aged garlic extract and 1.2 milligrams of SAC was found to be significantly lower systolic blood pressure when compared to placebo over 12 weeks in patients taking conventional and antihypertensive medications and having uncontrolled blood pressure. Study number 3 was a double-blind, randomized controlled trial that assessed the effects of aged garlic extract on clinic blood pressure, as well as central blood pressure, central hemodynamics, and cardiovascular markers, including cholesterol, homocysteine levels, platelet function, and inflammatory markers. 88 participants who were either treatment naive or on antihypertensive medications for at least 2 months with mean systolic blood pressure of 138 or diastolic blood pressure of 85 millimeters of mercury under trial conditions were randomized to either receiving 2 capsules containing 1.2 grams of aged garlic extract powder and 1.2 milligrams of SAC branded Kyolic, or 2 placebo capsules that were matched in size, shape, color, and odor daily for 12 weeks. Mean systolic blood pressure was significantly reduced by 5 millimeters of mercury overall and by 11.5 millimeters of mercury in garlic responders. Mean diastolic blood pressure was found to be significantly reduced by 6.3 millimeters of mercury in garlic responders. Garlic responders were those who had a mean reduction of greater than 3%, or 5 millimeters of mercury systolic or 3 millimeters of mercury diastolic blood pressure over time when compared to baseline. Central hemodynamic measures improved when compared to placebo, but not at statistical significance. There were also beneficial changes in total cholesterol, LDL, and apolipoprotein levels, as well as in inflammatory markers such as TNF-alpha. Adverse events included reflux, burping, and bloating, while others reported improved digestion. Most adverse events resolved after the first week of treatment. Limitations included small sample size, high dropout rate in the placebo group, which could have led to result bias, and groups not being matched based upon the antihypertensive medications they were taking. 2 capsules daily containing 1.2 grams of aged garlic extract powder and 1.2 milligrams of SAC were shown to significantly decrease systolic blood pressure in the treatment group and significantly reduce diastolic blood pressure in garlic responders. This was regardless of whether participants were treatment naive or currently taking antihypertensive medications. All 3 trials using aged garlic extract showed a significant reduction in systolic blood pressure, especially in garlic responders, regardless of whether they were treatment naive or when used as adjunct therapy to those who had uncontrolled blood pressure on antihypertensive treatment. 2 capsules daily showed greater compliance and effectiveness. Major side effects were mostly related to the GI tract and generally improved after 1 week of usage. All 3 trials utilized Kyolic aged garlic extract as their treatment capsule. There was consistent standardization of dosages across all 3 trials. There were no drug-to-drug interactions with antihypertensive medications reported during the trial, and platelet function was shown to normalize in one trial. Other garlic preparations have been shown to have blood-thinning properties at higher doses and have also been shown to interact with protease inhibitors. All 3 studies were 12 weeks, and significant changes in systolic blood pressure were found at the 12-week mark. Based upon the trials examined, there is not enough evidence to recommend beetroot juice for the treatment of hypertension. There is no standardized dose of nitrate in beetroot juice, and the amount of nitrate in each product will most likely vary. Also, as this is juice and beets are higher in carbohydrates, overconsumption could lead to an increase in blood sugar in those with diabetes. As for aged garlic, I would recommend it as adjunct therapy in patients with uncontrolled hypertension on antihypertensive medications. It may also be effective in decreasing blood pressure in those who are not currently taking medications for high blood pressure. I would recommend using Kylock at a dose of 2 capsules daily, as that was the brand used in all 3 studies, and it was what was shown to be effective. Kylock is also third-party certified by Good Manufacturing Practices. Using aged garlic extract has not been shown to interfere with blood-thinning medications or protease inhibitors. However, other garlic preparations have, especially at high doses, so I would recommend discussing this supplement with your physician before starting it. Other potential therapies for treatment of hypertension include omega-3 fatty acids, cocoa, and resveratrol. Omega-3 fatty acids have been shown to decrease both systolic and diastolic blood pressure at doses of 3,000 milligrams per day in untreated hypertensive patients. It is believed to work by changing the amount of intracellular calcium, generation of nitric oxide regulation, of vascular tone via the parasympathetic nervous system, and suppression of RAS. Cocoa has been shown to be the most effective in those with elevated or stage 1 hypertension. It is believed to work via dilation from flavonols and an increase in nitric oxide production. The average dose was 545 milligrams per day for an average of 5.5 weeks. Currently, the cocoa supplement and multivitamin outcome study is evaluating the role of flavonols in reducing the risk of heart attack, stroke, and death from cardiovascular disease, and the estimated completion date is sometime in 2020. Resveratrol is a polyphenol that is found in grapes, peanuts, and berries. It is believed to work via antioxidation, stimulation of nitric oxide production, inhibition of vascular inflammation, and prevention of platelet aggregation. Resveratrol was shown to significantly decrease systolic blood pressure when taking greater than 150 milligrams per day. These are my references. Thank you for listening.